How strange. All right. Hi, everybody. Thanks, Scott. And welcome to our webinar. As Scott indicated, I do a little topic each week. And based on a lot of stuff that's been happening with our clients this week, I wanted to talk a little bit more in depth about anxiety and sort of what that is and what we do about it and how it intersects with addiction, which does a great deal. So first of all, to start, I always want to clarify what is the difference between anxiety and fear. And they're two very different things. Fear is a natural feeling that we get that is a really important feeling, like all our feelings. Feelings are information that we need to go through the world safely and effectively. And fear is something that kind of tips us off that there's some danger in the world. What happens, though, if we don't really adequately feel and identify and express and ultimately release those feelings, in other words, we use them for the information they convey, then we let them go. But a lot of times we hang on to fear for all kinds of different reasons, feeling unsafe internally. It resonates with some of our negative core beliefs, or there's actual situations in the real world, whatever it is. We can keep that fear kind of recycling. And at that point, it becomes anxiety. So anxiety is this fear, which is a good thing that we need. But anxiety kind of takes that and flips it on its head. And it's not such a good thing because it can really cause a lot of distress. It can cause a lot of physiological issues. And it can, as I said, interface with addiction in a really negative way. When people are anxious, interestingly, most people don't know they're anxious until they have some kind of symptoms. So, and usually those symptoms are physical. There may be shaky or headaches or shortness of breath or other kinds of stuff. Everybody kind of has a different way. Their bodies have a different way of expressing it. But oftentimes people know something's wrong, they're not comfortable, but they haven't really named it as anxiety. Now, sometimes there's just a full-fledged panic attack, and that clearly is anxiety related. But it can be kind of less dramatic sometimes, but equally chronic. And that's a problem for a lot of people. What does anxiety do? It as I said, it's this kind of recycled fear. But what it does in terms of our addiction is that it really is a trigger to numb or to distract or to somehow cope with the feeling. We've mentioned many times before, addictions, whether they're drugs or behaviors, really serve to disconnect us from uncomfortable states, uncomfortable feelings, and move us off into that bubble, that fantasy land that we talk about. And there's nothing really more profound than behaviors or drugs to really null or neutralize the symptoms of anxiety, theoretically. The problem is it doesn't do anything to resolve the anxiety or fix the anxiety or cure the anxiety. It just temporarily resolves and kind of stuffs it down, basically. And that just causes more problems because the anxiety is unexpressed, and we have compounded addiction disorder going on as well. So remember that anxiety is kind of multi-parts. It consists of thoughts, feelings, and behaviors. We know that thoughts, in other words, how we kind of interpret the world, assumptions we're making, expectations, core beliefs about ourselves. I'm unworthy, I'm unsafe, I'm unlovable, people leave me, but whatever these kind of negative core beliefs are that we carry will feed this anxiety. And those thoughts create they actually perpetuate the feeling, and that results in behaviors. So if I'm feeling anxious and people are going to leave me, I might try harder to earn their love, or I might not even try to establish a relationship. We have different behavioral outcomes resulting from this anxiety. So it really filters through our lives in kind of unhealthy ways. So how do we see it in addiction? When people withdraw, and we know obviously what drugs cause in terms of substance abuse withdrawal, certain things like alcohol, benzodiazepines, opioids, famous for their withdrawal effects. A lot of people don't know exactly what a withdrawal from sex addiction looks like. And what it often looks like is irritability. That's the main feature, and a lot of anxiety. Because when we're starting to stop using our coping mechanisms, our tools, all those feelings start to bubble up. And so people start to get irritable because they want their fix to make it all better, but they're also starting to feel a lot of the anxiety that's been there all along. And so that irritability, that preoccupation, the apprehensiveness all really goes with the early days of stopping sex addiction and acting out. Other ways this expresses itself, an excessive need for control. If I'm having a lot of anxiety, I'm trying to make the world around me as orderly and safe as I can. And so we often find that people with anxiety disorders are overly controlling, if you will, or excessive control. They may have an excessive need for approval. I want you to like me. I earn my trust, my affection, my reassurance that you won't abandon me. So I kind of have that extra need to make sure that you like me and quell that anxiety that really is inside me. There's a lot of perfectionism. This belief, if I do something wrong or imperfectly, I'm going to get punished, or I'm going to get ignored, or I'm going to be left, or there's going to be a bad outcome. And so somebody with chronic anxiety often feels they can't afford to make a mistake. They have to do everything perfectly. And that, of course, sets a high bar, because nobody does anything perfectly. And so there's a kind of a constant up and down of expectation and disappointment, which only serves to further increase kind of this wave of anxiety that spills over. And then all this is amplified by negative self-talk. That kind of yammering in our ear of like, who are you? What an idiot you are. You screw up every time. Whatever your critical voice says, that just compounds it. That's like, seasoning on this anxiety disorder to start with. And so it's a real problem, because it feeds the anxiety and the addiction. It all kinds of compounds itself. So what do we do? There's a couple of behavioral tools, and there's a couple of pharmaceutical tools I want to talk about. One is to stay in the present. What anxiety does, it pulls us out of the here and now into the future, back into the past. We're worried about what's going to happen. We're worried about what we said or didn't say, and how that argument ended, 5 years ago, and we're worried about what's going to happen down the road. But all that takes us right out of the here and now. And as we're always telling our clients, the here and now is the only thing we have in terms of our recovery and our addiction, just this space right now. And so really focusing on skills of still learning to stay present, catching yourself when you're not. And we found with our clients, a lot of people don't understand. They're not aware they're future tripping or in the past, that they're not even here. And so it's really important to stay present as much as you can. The serenity prayer, what an incredible tool, because it helps us discern, what can I control? What do I have any power over versus what don't I have power over? And I think a lot of times the anxiety is compounded if we're trying to change something that we really can't change. We don't have that power to do so. And so that serenity prayer is hugely beneficial, I think, for not just recovery in general, but for anxiety in a big way. Learn to be aware of stress. Oftentimes we kind of we power through these anxiety issues, and we're not really aware of the issues that might make it better, might alleviate the stress. So if we can organize our lives a little bit more, or clear up the clutter, or organize or streamline our schedule, or make our to-do list manageable, and not, 15 things where we're bound to leave things undone and then therefore feel like a failure at the end of the day. Simple tasks like that can make it a lot better, along with relaxation exercises. Things like breathing, the 4-7-8 breathing we talk about a lot here, progressive relaxation, muscle relaxation, where you clench and tighten muscle groups and release them progressively in your body. Breathing in general, walking, exercise, all these things are really great physical ways to help start to release that anxiety. And then that critical talk, the inside job, basically, the critical voice that we have, the really demanding and harsh judgment we have of ourselves often, if we don't do things perfectly, if we make a mistake, and just kind of easing up on ourselves, having some grace to kind of go easy is a really, really important thing. And finally, I would say just behaviorally, not to be stubborn. I think sometimes with anxiety, we can kind of dig in and say, well, this is what it's going to be, because dealing with other alternatives creates a lot of unknown, and that causes anxiety itself. So I think kind of going with the flow is an important idea. Now, if it's more serious, if there's panic attacks, or if there's really chronic anxiety, there are other kinds of tools. Psychotherapy is extremely helpful. Cognitive behavioral therapy, which is kind of the main tool in a therapist's toolkit, is extremely effective for anxiety disorders. And then we can add to that sometimes medication. And we know both from depression and anxiety, the best outcomes health-wise happen with a combination of therapy and medication. But we got to be careful with the meds, because one of the ones that are commonly prescribed by doctors who should know better are benzodiazepines, the Klonopin, Valium, Xanax, that family of drugs, which really designed to be used in acute phase, meaning if I'm having a panic attack, those drugs are meant to kind of calm me down. They're meant to be used for a short period only. What they've started to do in this country is prescribe them just standing prescriptions. And first of all, they have a very rebound effect, a very strong rebound effect, meaning when I take it, I get a little bit of relief, but then the anxiety comes back even worse than it was before. And that happens because these drugs also create a high tolerance. And so I have to increase my dose. And it's just a bad thing. Bad, especially because the withdrawal from benzodiazepines is really dangerous and requires a medically supervised detox over a long period of time. So those are drugs to avoid. There are others. There's things like buspirone, which is effective for anxiety. There's some people use a beta blocker that kind of slows down the heart, which is a kind of a physical response to anxiety. There's other kinds of SSRIs, the common antidepressants that are also shown to be quite effective for this. So there's some medications. I don't think it's a wise thing to go to medications first. I would certainly try therapy, try talking it out, try behavioral changes. But then there are a certain number of people that are going to really need something else, especially if they're having panic attacks. Because that's almost a physiological reaction that needs that kind of strong intervention. So I'll wrap that up. So anxiety, just to say it, as a companion, an unwelcome companion for most addicts, and I would say for their partners as well. And there's a lot of tools out there to deal with it, but we have to first recognize it and then be willing to make some changes. And I'll stop with that. Thanks, Scott.
Thank you, David. Everybody, type your questions into the Q&A feature. We got a couple in there already, and we got a couple left from last week. So I think rather than me asking questions, I'm just going to jump into the ones we've already got. This first question is from last week, David. It started out with a betrayed partner wanting or not wanting to know the details about what women her husband had objectified, and we addressed that part. But then she adds, I want to know all the details because it feels unfair to be in the dark, but is that healthy? I mean, that's the part of the question we didn't address. So is it healthy for a betrayed partner to know all the details or to not know all the details? Is there a happy medium? What do we recommend?
Yeah, that's a great question, because it's very common for betrayed partners to want to know information and details in an effort to reestablish some emotional safety. And the logic is good. If I know the lay of the land here, if I know the scope of what's going on, then I can make a decision to go or to stay, to how safe I need to be, what kind of boundaries I might need to impose, that kind of thing. So I understand the logic of it. However, we recommend, and this goes along with the format of formal disclosure as well, to really kind of organize, categorize. We need to find this happy balance between being honest and having disclosure with integrity versus doing harm. And we have found that sometimes if we do as the spouse requests, which is like every detail, every last thing, we have found that ultimately is harmful to the spouse, because these are sometimes images that can't get out of their head. There's too much detail. There's overwhelming, and I think people tend to focus and fixate on it. It is really important, and I'll underline that again, that we have as honest a presentation as we can have in the disclosure. What we found that would be helpful, kind of a happy medium, is to talk about kinds of affairs, kinds of acting out, specifics over time, that kind of thing, as opposed to the actual nitty-gritty details. Now, if the exceptions to that, if someone is involved, for example, if there's been an affair with my wife's best friend, and my wife might be consulting my best friend out of the chaos and crisis that she's in because I'm in treatment, that's a problem. So we will actually disclose that right away, because we feel the spouse needs to know that. So those kinds of things are exceptions where there's something that it's vital for the spouse to know, but otherwise we do try to present a full and often painful, disclosure, but we have found to actually list all the specific details is not particularly helpful.
Yeah, and we always coach people not to use triggering language, to say oral sex instead of the slang term, or unprotected sex instead of the slang term,
Right.
Things like that, because the slang terms can be very triggering. The more clinical the language can be, it conveys the information, but in a more clinical way, and it's best done in a clinical setting as well. I mean, formal therapeutic disclosure has the word therapeutic in the middle there for a reason.
And Scott, can I say one more thing? We advise our clients when they're in treatment to not disclose anything else over the phone to their spouse. And that's done, again, to not do harm to the spouse. Most cases involve these rolling disclosures, right? Where there's a discovery, the addict will reveal certain things, but maybe not everything. And the spouse may think, well, okay, at last I kind of know what's happening. And then it happens again, right? And so these painful drip, drip, drip of exposure and disclosure, which is so painful for people. And so when they're in treatment, we ask them not to do that, to stop any more disclosure until the formal disclosure. And I mention this because often the spouses will press the person in treatment for more information. And we found there's been some really negative situations where, the addict is sitting there at Seeking Integrity with 24/7 staff and support and people to talk to and all that. Very often the spouse who really wants to know this information, because there's this logic of if I only know, then I'll feel better. But they're sitting at home by themselves. And so we've had cases where the client will say, okay, I did this and this and this. And now the spouse is sitting there with no support at home by herself, in a lot of trouble. And so we really ask people not to divulge and not to press until there's a formal disclosure.
Yeah. Okay, let's jump to the next question here. I'm a few weeks from discovery and wondering if I can live with a sex addict for the rest of my life. I'm under 30, less than 10 years with the addict, and less than 5 years married, but we have 2 young kids. He has been a dry drunk at best since discovery, but raging uncontrollably. So we separated for the safety of me and the kids. Am I crazy for wanting to work on my own recovery and healing, but not continue with the relationship?
Boy, it's so hard to know how things are going to unfold and the outcome. I'm always hopeful about things. If people are working their program, I've seen miracles happen and great recovery happen. There's a couple of things that are details there that are worrisome. One is raging, one is dry drunk. So we have somebody maybe who is involved but not fully committed to the recovery process, which is what a dry drunk indicates to me. And I understand, you're at a young point in your life, looking forward. I think I would maybe defer that, thinking about the whole future right now. I would do what you need to do right now for your emotional safety. And it sounds like you've done some of that in terms of establishing physical safety and all that. 2 young kids, I think I would make a go at seeing if it'll work. I don't know that you can make that decision right now. You don't know how it's going to unfold. And especially after the disclosure, I think is when you'll have more information. But, it's important in the meantime and afterwards, for that matter, to have good boundaries and to be aware and to know that this may be that, something you have to do to distance yourself even more. But I think that's a decision to be made down the road. And I wouldn't worry about it too much right now. I know that's easy to say, right? But I would really try to focus on boundaries and keeping yourself safe and working on you. I will also say, even if people split, if both parties, whether you're a partner or an addict, if you don't work on some of the issues that were involved in this relationship, what I've seen over time is that people tend to recreate the same pattern with a different person. And so you want to be careful about that too, because you might leave this marriage and leave it all behind, and a couple of years later might find yourself in a similar situation. So I think it's always useful to kind of work through the issues in real time whether you're the addict or the partner.
Yeah. And I mean, you're just a few weeks from discovery. I mean, we're really still in the heat of the moment. It's not the best time to make life-altering decisions.
Yeah.
So, like Dr. Rob often recommends, just putting the relationship in what he calls a safe harbor, just basically leaving it alone for 3 months or 6 months until the situation calms down. And then you can make a more measured decision, because it is a huge decision about whether to stay or go. And every betrayed partner has, this roller coaster where 1 minute I want to fix it, next minute I never want to see you again. Fairly normal. And the first couple of weeks after discovery is just turmoil city. So,
oh, for sure.
Yeah. My adult stepchildren, they're in their late 20s, are aware of my acting out. They do not live 14 months ago. I don't know if the acting out was 14 months ago or they've been aware for 14 months. They do not live with us. They have told their mom they don't want anything to do with me. And if I am back with her, they will not come around. She is struggling on the decision to try to reconcile or not. And this is a major wall against us working things out. How do I deal with this? How should I approach the problem? I am in therapy as well as SLAA, which is Sex and Love Addicts Anonymous, and have not acted out since discovery. So first of all, congratulations on not acting out and getting some sobriety. Now, David, all yours.
Boy, I wish I could give an easy answer to this situation. This is a complicated one, not one that's not unheard of either, right? With stepchildren especially, we often have entire families advising partners to just cut bait and run and leave. And often stepchildren whose allegiance, of course, is to their own parent and not the step parent. So I think again, I would try to give it a little bit of time. These are complicated issues that unfold over time. I've seen people kind of come around once someone is really making an effort and working their program. It sounds like you've jumped into recovery activities since discovery, which is great. I guess I would ask your wife to also kind of just put this on hold, as Scott just said, put that relationship in a safe harbor right now, because I guarantee the decision you make today will be very different from the decision you might make in 3 months or 6 months. Things are in motion and they're moving fast. And so I understand this is a terrible situation for your wife because she's caught between her kids and you. And I think it's one of those things where I wouldn't judge or make a decision based on how things look today, because I think things are going to go up and down and things are going to change and move forward. So I wish I could give you more specific advice, but I think just to kind of be, understanding of the conflict, be as supportive as you can be, and allow her the space to kind of figure out what she needs to do. It's going to be really important for the spouse to have adequate support, and it sounds like her kids are probably supportive of her. What I have found also, if people are willing, to really kind of educate themselves a little bit about the disease of addiction and the recovery trajectory and sex addiction specifically. And sometimes it starts to make more sense. I think initially when people hear about this, there's a lot of kind of outrage and shock and all the stigma that goes with sex addiction comes to the fore. So I would just kind of give this time to work its way through the system and see where you're at in, say, 3 months. I think it might be at a very different place.
Yeah, that's definitely a tough one. The next question here, 2 years after the initial discovery, my sex addict husband told me that he's been cheating for 10 years of our 12-year relationship. Is this all due to his addiction? Is he a pathological liar? Can sex addicts even know what love is? All very legitimate questions there.
Right. Kind of different kind of questions too. So, I mean, the shock of that, right, is kind of overwhelming to realize that for 12 years of marriage, there's been cheating going on for 10 years. We see this fairly commonly, actually, where these long-term cheating patterns that go on even before the current relationship, sometimes on prior relationships before that. So, this is hard to call, because lying and, compartmentalizing and cheating and having this other life is almost the definition of sex addiction to some extent. So it's hard to say if this is just sex addiction. I will say that, and by the way, lying also goes with sex addiction, and doesn't make necessarily someone antisocial, or although there could be flavors of that, but not necessarily. So I think it's important to understand that this is being revealed. I think it's really important for your husband to be actively working his program of recovery. I think also when we talk about what love is, frankly, most addicts, and I would say every sex addict, absolutely does not know what love is. Dr. Rob talks about, almost by definition, every sex and porn addict, it has an intimacy disorder. And that's true. To be intimate, we need vulnerability, we need trust, we need to have feelings and express them. And all those things are pretty much absent in the life of a sex addict, and probably have been for most of their life. So that's why we offer some workshops and skills for intimacy and even healthy sexuality after recovery. So, I think it's hard to say. Again, these are longstanding patterns. It is worrisome, I'll tell you that. But I think everything in my mind would depend on what's happening. What does the recovery process look like? How transparent and honest is this person in their interactions, in your check-ins or in your couples work? How much progress do you see? So I think, yeah, it's a terrible pattern, but I'm not sure that it can't be changed. Now, there are certain people, and it's a minority of people who really do lean more toward the antisocial side, right? The people that really have a hard time feeling remorse and have a hard time feeling connected. And so that can happen. And that's something maybe he should talk to his therapist about to rule out. But I suspect this is probably just sex addiction. That's what we see most of the time. And that behavior, as painful as it is, can be ongoing and longstanding. And it's what I would say also about the recovery process here is, when the pattern is that deeply entrenched, it's going to take a while to move into recovery, including, we've talked about this before too, in the early recovery, it seems like an addict continues to lie, even though it's not even necessary, right? It's almost habit. So those are the kinds of things that we want to see changing, and it may be a little slower than some other people here. So I understand totally your apprehension and your concern, but again, I would just kind of wait and see, give it a little bit of time.
Yeah, David, we often talk about sex addicts mistaking intensity for love. Can you discuss that a little bit, and what that looks like, and why sex addicts get, oh, I love her so much? Like, really?
Right. So over time, sex addicts, along with porn addicts, gamblers, work addicts, kleptomaniacs, there's a couple of different addictions that really work by ramping up intensity. And with porn and sex and amphetamines, it ramps up adrenaline and dopamine, and that creates these very intense situations that are kind of very hot and bright burning, especially in the arousal tempo, right? They're really hard to shake. But that intensity is something that people start to equate with intimacy, with love. So if it's not that kind of adrenaline driven intensity, it's nothing. And so one of the things we do a lot of work on actually is trying to differentiate between intensity and intimacy, between lust and love, between sex and sexuality. So I think there's the scope of what sex is to a sex addict becomes very refined and kind of narrow, and it's kind of limited to intensity sometimes. And so we recommend, obviously, learning some intimacy skills, as I said, a lot of guys don't have, and which involves understanding compassion, trying to build empathy, communication skills, breaking down things like erotic intelligence, what those are kind of building blocks that have to happen. And then there's this shift of that intensity does not equal intimacy, does not equal love, right? Because intimacy and love can include those high adrenaline dopamine moments, but they can also include tenderness and other kinds of hormones like oxytocin, the love and bonding hormone. So there's different feelings that can happen when true intimacy occurs. But the intensity, that's a big mistake people make often, is going for the intensity. If the intensity is not there, they confuse that for falling out of love or not having an adequate connection.
Yeah, the beautiful thing about recovery is, and David's right, this does take a while to get to this point, but just because I don't know what love is when I'm in my addiction, it doesn't mean I'm incapable of love. Once I learn to have some empathy, once I learn to build empathy, once I learn to be vulnerable with my partner and allow my partner to be vulnerable with me, love can really, really grow out of that. And there's usually a connection, a real connection. I mean, you wouldn't be married if there wasn't.
Right.
That connection has a chance to really blossom and grow in a way that it never would have, probably even without the addiction. The recovery kind of brings out the best in us eventually. So
Absolutely. Yeah, I think, and I know a lot of couples who really feel much more deeply connected than they ever were before. And these are in recovery. And, the Stephanie Carnes talks about that one of the timelines for, couples recovery is being up to 5 years, right? For the different stages of kind of reestablishing the connection and breaking through the intimacy walls and really starting to connect at a really deeper level. So this is a long-term process, but it's absolutely possible. And the rewards are tremendous.
Yeah, definitely. Okay, this next one, discovery was 4 years ago. My sex addict husband has been in 12-step couples therapy. He is not acting out with the things he did before, but he still directs his anger at me and is in denial by telling me he has not acted out in 4 years, but I know there's still porn and not porn. I feel I will never be safe from his addictive behaviors. Any ideas will help. I have boundaries, but he says I keep these to distance us as a couple. I feel this is gaslighting and it's still cruel behavior. Is this just anxiety about the life we had or have? A lot packed into that.
Right. So we've talked about this before, where people in recovery programs don't really manifest symptoms of recovery, meaning they may be checking the boxes, right? They may be going to meetings, they may have a CSAT, they may do certain activities, but for whatever reason, behaviorally around the house, they're irritable, they blame, they shift blame, they don't take responsibility. I mean, all these are red warning flags that the extent of the recovery activities isn't quite meeting the minimum requirements, right? And so these are signs and symptoms, and you're absolutely correct to kind of observe them and look at them as red flags, because that's exactly what they are. When we talk about not acting out in 4 years, however, using, and even not maybe looking at porn, but looking at what we call not porn, we've talked about that here before as well. But what we know, we don't have to look at a pornographic image to get that dopamine and adrenaline flow and get high, basically. We can look at all kinds of stuff. And that from everything from, TV shows or movies or magazines or not porn. And when we say not porn, we're talking about things like Facebook and TikTok and Instagram, where people are posing a lot of titillating photos, right? They may be clothed, they may be not X-rated, but there's certainly enough for an addict to have a good fantasy trip with dopamine. And so we see this a lot, less so now as people are getting more aware of it. But I think a lot of times people said, well, I'm not using explicit porn, and that's maybe my inner circle, and anything else is okay. And it's not okay. We know that when we get these dopamine drips starting from things like not porn, it's equally as addictive and equally as much of a high as explicit porn. So that really has to go. And
it's like drinking beer instead of whiskey.
Right.
I'm still getting drunk.
Exactly. And what that does basically is kind of freeze the recovery process, because you're still actively using all those kind of addictive pathways in your brain and not really working the recovery. So that's one thing I think really needs to be cleaned up. I don't know if you guys are in any kind of couples therapy, but it sounds like kind of a profound misunderstanding of boundaries. And maybe that's just him blaming or being ornery, but of course, boundaries are to protect the person, and you need to have boundaries, and you should have boundaries, and boundaries mean consequences for him. And that's, I think, what he's pushing back against. He's blaming the boundaries, but I think he's really he's being busted, and that's not good. So these, I have found when these kind of scenarios, it might need a third party to kind of negotiate some talking about this, because he may not be willing to hear it from you about the importance of boundaries and not porn and all that. He may need someone, a therapist or somebody with a little more authority perhaps, to talk about it and to work through any misunderstandings, just to save your both self a lot of time and arguments. Probably it's useful to have a session with somebody to talk about this. But you're noticing everything you need to notice, and he's got some work to do.
Yeah. And what I will say about boundaries, healthy boundaries are not about keeping other people out. It's about letting them in safely. And if he's not safe for you right now, you don't have to let him in. And he can say that you're using the boundaries to keep him away, and you are. But that's not a bad thing. You need to feel safe and make sure he understands when you're safe, I'll let you in. I want you in when you're safe, but you're not safe right now. I don't know if that will help him understand this, but I agree with David. Having a third party come in and mediate could definitely be helpful. This one, gratefully recovering sex and love addict. My wife has long felt that I have ADD. I've recently heard that ADD is highly co-occurring with sex addiction. If I address the ADD, would that help my recovery? I think we call this ADHD now. Is that correct, David?
Yeah, there's subgroups, but yeah, ADHD or ADD kind of interchangeably used. Yeah, so interesting question. And there is a lot of ADHD and ADD. There's two slightly different things that go with sex addiction. It's a kind of a little bit of a mysterious thing. ADD is overdiagnosed in the country, and so a lot of people have been told they have ADD or ADHD or think they do, but it's never really been officially diagnosed. So it's certainly something to look at and pursue, because what happens if you do have ADD or ADHD and you're trying to get into recovery, it's going to interfere with your ability to focus on your recovery activities, to be consistent, to manage things in a proper way, because as anybody with that disorder can tell you, it's extremely unnerving. You get very scattered, it's hard to focus, you get easily distracted, and all those things really take away the power of the effort of recovery. And so I think it's useful to get it checked out if you suspect it. Talk to a therapist. There are some screening tools that at least can give you an idea. And if you do have it, there are some really effective therapeutic tools, including cognitive behavioral therapy, talk therapy, and medication. Now the medications, I always kind of warn, most of the medications, not all, but most of the medications that treat ADHD are stimulants, and they're very effective for people that actually have the disorder. The problem with stimulants is they're easily abused, and they do kind of mimic the rush of sex addiction with the adrenaline, the dopamine, if they're overused. Now, I've been told by a therapist who has ADHD that if you truly have it, the medication is really filling in a deficit of that particular chemical that you need, and you're not getting excess. And I think that's true for a lot of people. But the problem is that sometimes people are overdosed on the medication by prescription, or they take too much. So I would absolutely look at it. Yes, it will affect not only your recovery, but it's going to affect your quality of life. It's very distressing sometimes to have that. And I have had people that would get on the medication or go through therapy and medication and talk about kind of basically how their life was miraculously kind of changed, because they could focus, they weren't distracted, they could follow through on things. and it's quite effective. So definitely check it out because it will affect your recovery in little and big ways.
Yeah. You did a podcast, and Dr. Rob did a podcast with Dr. Todd Love, who's a kind of a specialist in this. I put the link to both of those in our in the chat feature. So if anybody wants to link to that.
Yeah, and Todd is the one that said basically if you're adequate, then you don't need to worry about excess medication in your system.
Yeah. My sex addict husband and I are struggling to just feel connected. I find that I'm always on edge and worried. We want to be able to have fun and enjoy time together again. He's working recovery very hard, and I'm getting a lot of help as well, but there's still just this lack of connection. I question everything all the time and wish I could just feel settled in the relationship. This especially affects our physical intimacy. Any tips? What a great question.
Absolutely. And trying to reestablish that connection, which most couples want, it can be very frustrating, and because there's so many factors that can undermine it. One is just the anxiety of the spouse, and just given the history, all these things that happen, and it's very traumatic, and so that can affect this feeling of safety and the establishment of safety. Communication patterns have sometimes been really badly disrupted or never existed. The addict, if we talk about a man, often kind of classically has this lack of intimacy skills that we talked about earlier. And so a lot of things kind of come together to undermine the intimacy. What I've found is connection in terms of check-ins are a great way to start. Just communicating what's going on, communicating feelings, talking about issues. We've modeled here before about how an addict, if there's a slip or God forbid a relapse, can talk about the internal process with his spouse once it's been taken care of. So that kind of transparency, I think, starts to reassure the spouse. So anything we can do to reduce the anxiety, to increase the connection, is important. I think communication is important. I love the idea of doing fun things together. I think sometimes a couple can just focus on this addiction all the time, and of course it's a major force, an unwelcome visitor, right, in most homes of sex addicts. But it's really important also, if you can, to go off and do other stuff totally unrelated to addiction recovery. Go have fun, go take a walk, go a bicycle ride, play tennis, anything, because part of the task of reconnecting is making new memories, if you will. And of course, sometimes people don't feel safe enough to do that or comfortable enough to do that. But I would really push it as soon as you are, and do what you can to kind of break the trap, really, of just focusing 24/7 on the pain and the misery and the trauma. And we can't ignore it, but we can kind of balance it out with other things as well. The other thing I will say, there's for establishing connection, and this is a little bit down the road, perhaps, when there's a sense of physical safety. But I've mentioned before, Masters and Johnson has an exercise called Sensate Focus, which is a communication exercise. It's an intimacy exercise for couples, where there's a pleasurer and a pleasure receiver, and it's all based on touch and verbal feedback from the one getting it. And you take turns and you switch. But it's a really nice way, long-standing. It's been around 50 years. It's a really nice way to start to reconnect once the emotional safety is there, and also, by the way, it's great for the sex addict, because sex addicts have learned over time the only pathway to arousal is that intensity we were speaking of a few minutes ago, and they're not going to find that intensity unless they're acting out. And so, how do you get that with your partner when you really want it? And we found that this Sensate Focus, because it engages the body's response to touch and physical touch, which is incredibly healing, first of all, but it's also a great way to reconnect and actually get aroused. And so Sensate Focus, you can Google it. There's it's a simple protocol. It's on the web everywhere. And that should be helpful too.
Yeah. David, we often recommend to addicts at the right time, which is not right out of the gate, it's once they get some sobriety, that they get some trauma therapy to work on their underlying trauma issues, and that usually EMDR or something like that helps them sort of settle in a little bit. would you recommend that for a betrayed partner in this situation, perhaps? Or
Yes, we talk about betrayal trauma,
right,
and that's not just a coincidence. The experience of partners actually manifests a diagnosable clinical trauma in response to what they've gone through. And so, yeah, absolutely, trauma work is really important. We've talked here before about it. There's lots of different trauma modalities, EMDR and brain spotting and somatic experiencing and a bunch of others. What makes them unique, I guess I should say what they all have in common, is that there's not only a talking component, talk therapy, there's a physical component, a body awareness component. Like I do EMDR with clients and my private clients, and we can talk about not only the trauma itself verbally, but we're talking about what they're experiencing inside. What feeling is it? Where is it? Is it shifting? And by making that body connection, it's very therapeutic. So long story short, it could absolutely be beneficial for partners who have experienced trauma and who are probably living some of those trauma symptoms. In fact, I think a lot of the anxiety, the need for information to reassure is a trauma response. And ironically, it usually creates more trauma because people think, well, if I have this information, I can relax. But well, maybe there's more, right? It's always this like nagging doubt. I don't know everything. And so that's not an effective strategy, but trauma therapy is, and it'd be really very useful.
Yeah. Okay, next one here. Married 43 years with porn addiction off and on. The spouse says he's healed, and if I trust God, I'll believe him that he is not an addict. I agreed and think he has been sober 6 months. He's not doing any recovery work. We have sex every 6 to 8 weeks, which he says is not enough or good enough for him, but he is not responsible for my desire for him. Recently he said, I'm okay with denying him sex, but get mad if he wants to go elsewhere. He has underlying anger issues. How do I deal with all of that? Another question with a whole lot packed into it.
Wow. Yeah. So, yeah, first of all, I'm not sure God has much to do with this in terms of establishing trust. Trust, that's really behavior and what you see and what you see and feel in the relationship. So, I think if he's been sober for 6 months, that's one thing. However, if somebody's not doing any recovery work, that's greatly concerning to me because in my experience, nobody who's really an addict can just say they're going to stop and be fine. They may not act out. I've seen people basically in a dry drunk, sometimes for years, kind of by the white knuckling their sobriety and not acting out, but they're usually angry. They're shifting responsibility, as I kind of see here. They're not taking responsibility for themselves. They're really on the edge of acting out all the time. And so I think first thing I would recommend is to get engaged in the recovery programs and probably therapy and really start working a program, because just marking off days on the calendar and doing nothing else is not going to do anything. It's only going to get worse. The other thing in terms of there's couples therapists talk about a relationship as kind of a house. And if we have somebody having an affair or somebody kind of acting out, they're kind of going out the back door and they're letting energy out of that house, right? They're out of the relationship. There's a leak. And when I hear things like this, maybe going elsewhere besides it's not going to work for a relationship, those are all leaks, right? Those are all taking energy away from what should be worked on in the relationship, problem solving in the relationship, communicating in the relationship, not looking externally for some solution that's not going to work anyway. And so where does that leave you? I think, first of all, you have to be comfortable with having sex or not because he's demanding it or making threats veiled or not. You need to be comfortable and emotionally safe with it. And I think communication here is going to be really critical for you guys to talk about this. You have a right to your feelings. You have a right to setting boundaries. One might be that he gets into a program of recovery or gets into therapy or starts attending meetings, or those essential steps. So I think really we talk about phases of bargaining in addiction recovery, and it sounds like he's kind of been stuck in bargaining right now. He's only going to do so much, and he's going to set to see as much as he can get out of you, and kind of this weird negotiation. I would stick to your guns, have good boundaries. Otherwise, it's just going to get worse, I fear, if he doesn't go to program.
Yeah, I mean, I just hear so much blaming and shifting of responsibility. I'm not getting enough sex. I'm not getting good enough sex, so I have to go elsewhere to get it. And if you're mad at me, that's on you. What? I mean, what? Why is his addiction somehow your fault? And why is it your responsibility to believe him after, porn addiction on and off for 43 years? He has not earned this. Yeah, I just, yeah. There's so much denial from the addict and the things he's throwing at you, and it's almost gaslighting, because it sounds like he's got you believing some of this, and that's what happens with gaslighting. They just lie to us loudly enough and often enough that we just give in and start to believe them. I don't know, what he's describing is not the reality you're experiencing. And if I can just give you one piece of information, I mean, trust your gut.
Yeah.
More than him right now. He's been cheating on you for off and on for 43 years. So anyway, that's my 2 cents.
Yeah.
Betrayed partner experience. I like to have enough information for me to feel like I own the story too. It's no longer his story, it's my story too. It's no longer his secret and separate from me. It feels like it takes away the power and pleasure of his secrets. That is a very healthy statement, I think, Dave. It's kind of what we described earlier. There's,
Absolutely. With it's the need for information, but I think to really understand what's going on and to really make sense of it, all toward the end of kind of reclaiming some sense of emotional safety in this relationship and willingness to work on it. And because the act of the betrayal creates so much havoc and so many walls and such a chasm between people that the effort to bridge it can be pretty overwhelming sometimes. So I think, yeah, to work this through, it sounds like you're kind of taking this process and internalizing it and working on it, and as you say, making it your own. And I think that from that place, to me, what I love about this statement, it's such a place of power. You're really standing on your feet and grounded and say, okay, this is what I see, this is what I know, and you have choices, to move forward or not. But I think I love it. I think it's great.
Yeah. Both Kristen Snowden and Michelle Mays, who are both friends of mine and I think wonderful therapists, talk about empowerment as a really important part of betrayed partner recovery.
Right.
And the empowerment starts with the truth, getting the truth, not in a triggering, agonizingly painful way, but getting the truth so that you can incorporate it into your reality and then make decisions based on a place of truth, rather than this false experience of the relationship that you had through no fault of your own, and that you might still like to have because it's a whole lot easier to, it's a whole lot less painful to not deal with the truth. But if you want to empower yourself and empower your relationship, it starts with the truth, and owning it as part of your story too. I love the way you phrased that.
Really great.
My ex-partner has a long history of relationships while acting out for the past 50 years. His family is known, friends and adult kids know, but still do not say anything to the new girlfriend he brings around. Their response, this is an ex-partner we're talking about, their response is that they think because he is in a relationship with a great person, he must be good now. I hear all the time in the groups not to say anything to the new partners. This thinking does not sit well with me. Family gives a false sense of good values. Thoughts?
Yeah, that's a tough one. You know, we talked earlier about how we tend to repeat things if we don't get it right. And sounds like this guy has a pattern of kind of betrayal and acting out and finding new people to engage with. You know, at some point, I'm not sure where our responsibility starts and stops here. I think it's one thing to kind of live in this sort of happy denial that it's all good, which I think is far probably from the reality. I'm not sure it's our place to inform new people about the entire history. I think probably some of it, depending on the relationship and the circumstances, might be useful, but I'm not sure under what circumstances that would even take place. Scott, do you have feelings about this? I'm struggling.
No, I mean,
what to say.
It's your ex-partner, and it sounds like he's been an ex for quite a while now.
If he's bringing around his current girlfriends, probably, yeah.
Yeah, I mean, I don't know.
I'm not sure it's your business anymore, and that's where
Yeah,
I'm struggling.
yeah, that's kind of where I am. It's like he's your ex. We have one more. Can we do one more? Yeah, we got a couple minutes left. Oh no, we have several more. Sorry, that's not going to happen, but let's do one more.
Okay.
Spouses used porn off and on for years. Discoveries, apologies again and again. 6 months ago, he said God healed him and he's no longer an addict. I think we just had this question, but a version of it. My spouse's therapist, who he no longer sees, said he was not an addict, but just has a lifetime of abuse. He has used porn on. This is the same question again. Betrayed pals, 8 months since D-Day. My husband and I both have CSATs, going to group. He's going to 12 steps. The last months, there has been at least one new discovery a week. I'm so tired and feel like my anxiety is sky high. He wants to talk to me, but I don't want to talk to him. I find him very annoying because I feel like he reels me in to start to connect, and then I discover something else. At this point, I don't even want to speak to him. How do I move forward? So we're getting trickle truth, which is agonizing.
Right, totally. I think that in a simple word, boundaries, to set some boundaries with him about when you'll communicate or not. I would think about separate physical space for a while. I think anything you can do to kind of interrupt this cycle, because it sounds like he's gotten comfortable with this pattern of, as you say, reeling you in and then to let you fall again. And so you're the one that can stop that pattern. He probably won't until he's forced to. So I would suggest really putting out clear boundaries that what you put up with, even how much you interact with him, because until he makes some change. That's in the word boundaries, I would say.
Yeah. So, okay. We are out of time. We got one question left. I'll try to copy and keep it for next week. Thank you, everybody, for being here. Great topic today, David, as always. I will get this posted online on YouTube tomorrow. And same time, same place next week. We'll see you then.
Sounds good. Thank you, Scott. Take care.